Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession. Thank you for joining us on another week of the RD2BE podcast. I'm joined with Dr. Jeanette Andrade. She is another DI director that we are more than happy to showcase for you listeners. And she is more specifically the MSDI director at the University of Florida. So thank you for joining us today, Dr. Jeanette. We're really happy to have you.
Yeah, absolutely. Thank you for inviting me.
And so first, we kind of want to set the stage of how did you specifically obtain your position as DI director?
By accident. And that's honest to God truth. So a little history, because I love historical contexts, is I never dreamed about being a DI director. I think it's one of those weird life goals, right? Where you probably don't ever envision yourself to be in a CEO kind of position unless that's your true desire in life, right? So I was a clinical dietitian. And then I decided to go back to school, get my PhD. And when I was finishing up on my PhD, I didn't know where my life was going to head. And so one of my previous master's advisors reached out to me and said, look, I'm looking for a person to teach at our university. Would you be interested? I said, yeah, sure. I have nothing else to do. So I started teaching there. And then she said, well, and by the way, our DPD director left. Would you mind being the director? And I thought, yeah, sure, why not? Whatever. So I became the DPD director. And lo and behold, the year later, she's like, our DI director left. Do you want to be the DI director? And I said, yeah, sure, why not? And so I will tell you, I respect DPD. No, I mean, that's how, but it's just fun being a DI director. It's fun learning new people and hearing stories and everything else like that. So for the past, I want to say 8 years or so, I've been the DI director. So yeah, that's my story by accident, really honestly. And so I've liked it. It's been fun.
That's good. And it's so funny to hear like your response to just all of those promotions throughout the University of Florida was just, yeah, sure, why not? And, just like those kind of, just like those attitudes and stuff. And that just made me think, this is just a side question. Whenever you're going into these new positions and just like kind of going to new manager territory, how did you just like go in with such grace? Would you say just like being like, yeah, sure, or just kind of?
I don't know if I would say grace. I always am up for a challenge. I think that was the whole thing, right? So one thing is, for example, when I was going throughout my dietetic internship, everyone would ask me, what do you want to do? What do you want to be? What kind of dietitian do you want to be? And I'm like, I don't know what I want to be. And then there was a position that opened as a food service manager. And so I thought, you know what? I like food service. Not many dietitians go into that. So yeah, I think I want to try it. So I think I've always had this kind of, not necessarily because it's a director role or a management role or anything else like that, but it's kind of like, I want to challenge myself and I don't know much about it. And so I kind of go in with literally eyes wide open mind, everything, because I don't know what to anticipate or what to expect. And so this is kind of how I thought about the DPD and the DI role, is I really didn't know what to expect. I knew a little bit. I knew I had to manage students. That was about it, but I didn't know exactly what else it entailed. And maybe that's because I do ask a lot of questions. You should ask my program coordinator. I do ask a lot of questions. But really for a job, I guess I'm not that type of person that's like, what am I going to do for every minute of the hour? I kind of go in like, all right, I know I'm going to be doing stuff. I don't know what kind of stuff. And then you kind of craft it to your own responsibilities of what you absolutely have to do. And then what you're like, okay, what else can I explore with this? So yeah, I guess kind of going in with open mind and just being like, I don't know what to expect. Let's see what happens.
And I think that's a great mindset to also reflect on to dietetic interns and just, dietetic students in general. And I think it's great that they have a role model like you if they do your program, just because a lot of us are type A's and we're very much like we want to know what we're doing every minute of the day. But whenever you have, someone in your position and someone in your program being like, yeah, just go know the baseline, but then just kind of explore off of that, it's a really great way to kind of ease some of that stress and just know it's okay to not know everything, and just going into the program with that open mind and learning as much as you can. So I think that's really great. And kind of like going into your dietetic internship specifically and how it's an MSDI, a lot of MSDIs they format their program differently, and then you have future education models, graduate programs, all that jazz. You just have a whole lot of acronyms thrown at you. So for your program specifically, how do you divide that master's degree and dietetics internship portion into your program?
Yeah, so you talk about type A and not seeing, so, and yes, I am locked in that mind where it's kind of like someone throws something else at me and I'm like, wait, how can I see that differently? So throughout our program, and again, I've been in this particular university now for close to 5 years. So our previous director, who has led that program for 20 years, it has always been the first year and a half or so of doing graduate coursework, and then the rest of the remaining time doing the internship. So that's kind of how we split it up. But I will say, since I started the program, we do what we call a summer practicum to allow students to, because nowadays, not to say that students don't have the ability to do clinical work or anything, but it's a little bit more constrained than it used to be, right? Back in my day, when I was trying to get some volunteer work at the hospital, they were like, yeah, sure, follow me, whatever, do something. But now it's a little bit harder, and especially COVID didn't help the situation. So it's more restrictions and everything. So a lot of our students may come into our program not having a lot of clinical knowledge or skills. And so when they hit the internship, I get it. I mean, it's kind of like, but I wanted to know this stuff before I actually got into it, because I didn't know what to anticipate. So we have a summer practicum where they do get internship hours. And so they get to do it over the summer before they actually finish their remaining coursework and then go into their internship. So we kind of do it split almost.
I gotcha. And it's kind of a little pre-internship preview before they kind of dive right in for, the rest of their program doing the dietetic internship, which I think is, it's a good way to get your feet wet, because, you start with the concepts and then you migrate into like that practicum and then you go into that dietetic internship. Is that correct?
Correct. Yes.
Awesome. And then for the master's portion, you guys offer a thesis and a non-thesis option. And so can you kind of go into like the differences between the two and why you offered those two differences for the master's degree?
Yeah, so majority of our students actually choose the non-thesis route. We don't necessarily, when we interview students, we don't say, so what do you want, thesis or non? It really is set up to be non-thesis, with the caveat of, if students do desire to do a thesis, we can absolutely discuss that. Our program, so for thesis, really, when you think about a master's traditional, and this is just because we are a Research One institution, so I have to preference it by that, because the demands for our research may be quite different than the demands of, let's say, a tier 2 or tier 3. And I did come from a training where we were considered a tier 1, which meant absolutely nothing to me when I was a student. But then as you start working in the field, do you realize what this actually means? So as a tier 3 research institution, you could really do your thesis and then do an internship within 2 years, and there wasn't any issue. For our program, you would really have to set yourself up to say, okay, I'm explicitly going to do 2 years of research, which is typically what we expect for a master's student, and then do an internship on top of it. So really you are doing a 2.5, almost 3-year program because of the intensity of the research that you're doing. So what we try to do to balance this out, because we do understand that some students want to get in that research experience, because that's honestly why you do a thesis, is for that research experience. So we allow our students to do a lot of different research that they want to. So there is a research planning class that students have to take. It's a requirement, but they work as a group to kind of do a research problem. Some students decide outside of that they want to pursue additional research. So for example, this particular year, I have a student who is working with me and a collaborator of mine who's doing a study with cancer. We're doing a small, really small pilot study. And, you know, because she is thinking that she wants to pursue actually medical school, so she needs some research experience for that. And she said, well, if that doesn't pan out, maybe I'll go and get a PhD, right? So we provide that ability to students who they don't necessarily have to write a thesis. They can maybe participate in conference presentations based on small research that they're doing in someone's lab, or maybe help publish a manuscript with that particular advisor. So that's kind of how we craft this whole thing of, it's a non-thesis, but you can still get that research experience if you so desire, without having that pressure of actually writing a thesis, because it's not as easy as what many people think. Think about writing a very long piece of paper and how many hours you actually want to spend on that, and then just kind of multiply that by how much time it's going to take you to actually write a thesis. So not to detract anyone from doing a thesis, but I did a non-thesis master's, still went on, got a PhD. So, you know, you don't have to do a thesis if that's not in your calling.
Yeah, definitely. And so you talked like, and you had mentioned how, you know, you offer that research component in your program, but do you dive into any other niches of dietetics specifically that your program focuses on?
So it depends on the student and what they are kind of seeking. For example, in our summer practicum, adhering to the new ASCEND guidelines, where it's 1,000 required hours of an internship. And so obviously we want to be competitive with the other sites that are out there. So we do restrict it to 1,000 hours, or close enough to that 1,000 hours. But in our summer practicum, we allow students to do 3 weeks of exploring. And so my program coordinator calls it the exploration. And really students can do pediatrics. They could do, if they're very interested in like community development, food service, but more on the college side of things, if they wanted to do more outreach. So they can have 3 weeks full of, you know, sports nutrition. So they can kind of see, what would I actually want to do? A lot of our students, though, you know, even though they're like, I want to do clinical, I love clinical, after they do their internship, maybe they find out that they want to go in a specific niche of clinical. So for example, I had a student who graduated, and I do kidney disease research. So I'm always like, try to be a renal dietitian, get into that. And a lot of students probably think I'm nuts. But one of our graduates, she was just really, after she learned a little bit about renal after our summer practicum, and she was like, you know what, this is not a bad gig. I actually would want to work with these individuals, because this is a very complex disease state and the people really need help. They're nice people, and, you know, just a little bit more compassion and everything. So she's a renal dietitian. She never, I mean, aside from our small summer practicum that had 3 weeks of renal, that was it. And she decided, well, you know, I'm going to pursue this as a career, and that's what she's doing now. So I don't want to say we specialize in anything, but I mean, it is craft it to what a student wants within the bounds that we can actually do it, right? If a student just wanted to solely do community nutrition, unfortunately, our program doesn't allow for that, just because we do have to integrate food service, we do have to integrate clinical, and so it'd be challenging for at least what our program is accredited for to allow just solely community experience.
Yeah, so you get that wiggle room that if a student does find interest in a specific type of dietetics, you allow them to dive into that. But again, like with the Ascend guidelines, you still have to check specific boxes for certain hours, but you still allow students to explore, like with what you mentioned, with what the coordinator does, you allow them to explore their interests, but you don't constrain them to a specific interest within your program, which I think is really great. And so whenever it comes to the students that do apply to your program and get accepted, do you know the like rough numbers of how many students typically apply and then how many you accept for the program?
Yeah, so it depends on the year. I'll be very honest with that. My program coordinator and I were just looking at this. So typically, what we want our students to do is not only apply through DICUS, but also apply through our UF graduate school as well. And for the past couple of years, we have noticed that more students apply to DICUS, and it could be because they may want to wait until they know for sure if they're going to be matched to our program to actually apply to our graduate school. So with that in mind, for the past couple years, we've had a little over 30 individuals apply to our program, and then we accepted 8. And so and it's not to say like, my gosh, I don't want to apply to your program because you only accept 8. Here's the thing. We would love to expand our program. The constraints are we're saturated. We're in Florida. And so we have a lot of hospitals who have a lot of interns there as well. And so that's really our constraint with accepting more individuals. We would love to get the best and brightest and the highest quality students that there are. But unfortunately, there's limitations with our hospital sites and our preceptors and how many they could take on without burdening them too much.
Yeah, definitely. But I think it is, there are benefits to having a smaller class size for sure. Just having, more of a connection with those interns that are going through the program and just having more individualized approach for sure. But kind of going into the student experience, how do you ensure that your students do feel supported throughout the program? Because you mentioned there are a bunch of hospitals around, you have a lot of resources in Florida, but how do you guys specifically give them support?
Yeah, and again, this goes back to comfort of the student, right? So I have some students who, they like to meet. So I'll put it this way. Every month we do have a monthly meeting with the students to just kind of check in, see how everything's going, where they're coming from, etc. And so some students within that will decide, I do need to have things are going on in my personal life. I just want someone to chat with. I just want someone to help me. We always try to be there, but again, it depends on the comfort level of the student. While students are into the internship, we always, say to them, hey, let's do a weekly call. Let's do a bi-weekly call, whatever it is. And a lot of students are like, hey, I'm fine. I don't need that. But then there's those breaking moments. And I think that happens. So we tend to send out text messages while they're into the internship of saying, hey, we know like I'll just say they're starting clinicals this week. And so we're like, hey, you may feel overwhelmed today. Don't worry, you're not a dietitian yet. Calm it, keep it cool. Don't compete with one another. If one sees 4 patients and you only see 1 patient, don't panic. You're doing great. You're doing what you need to do. So we tend to send out supportive messages, whether or not a student really needs it or not. I know sometimes what I felt lacking from my director, and I mean, my director's wonderful. We're friends to this day, but it wasn't that. It wasn't like sending out messages of just checking in and seeing how you're doing. It was kind of like up to you as a student to pursue the director to say, hey, I need to talk with you. So we tried to do as much of both ways of we're here, here's some, crazy, inspirational, silly kind of message. But if it gets a student over that hump without without them feeling like I have to reach out, I want to talk about this. So that's kind of how we try to support students throughout the program.
Yeah, and I think it's good that you have that baseline level of support, because I feel like, I mean, I'm not an intern or in an internship yet, but I do feel like, especially when you're like in the trenches, just with anything in general, you kind of forget that you do have a support system, and it is okay to ask for help. In like, everyone's like path is very different. Like with what you said, even if one student sees 4 patients and one student still only sees 1, that doesn't make one better over the other, because you both are learning at your specific pace, which I think is really good, and that you guys just offer that support from the get-go so that they don't feel like they're on their own, like with what you mentioned how you felt during your internship. And so you mentioned like you offer a great method of support just from the get-go, and then you do have a very nice organized program with a lot of flexibility with what the student specifically wants. But are there common things that interns enjoy about your program?
Yes, there are. And it kind of goes back to what you said about having a small class size, because, administrators may not love that because they want as many as possible. But at the same time, they build relationships among each other. So for example, the current students who are doing their internship at this moment, who came in about a year ago into our program, they go to each other's houses, right, every week. And so they have like a dinner, and or someone's feeling awful, and so they'll go grab some coffee or whatever else like that. So they kind of have that internal support network, which they do like from our program. The other thing that they absolutely love, we get so many evaluative comments about this, the advanced medical nutrition therapy. They love that class. And the reason being is because the faculty for that class, she does a lot of debates, and she does a lot of, let's like questioning, right? So for example, is the DASH diet the best diet if you have hypertension, right? And so they debate about this, and students love it because they find out, wait a minute, is it actually the best diet? Should I actually be promoting this to every single person that I meet, right? So she kind of opens up this communication and this network that students feel a little bit pleased about. Other things that they like about a program, obviously the internship. They just rave about the internship. They're like, that's amazing. I'm like, well, yeah, you want to be a dietitian, so yes. So there's a lot of little things. And I think sometimes it's once they graduate, then they're like, oh my gosh, I learned this, I learned that. And so you're right. Like when you're in the trenches, you lose that. You forget, like, why am I doing this in the first place? And you may feel down and not happy. But then once you graduate, once you get a job, and you're like, oh my God, that actually wasn't, that was stressful, but look at what happened afterwards, like all these amazing opportunities that came my way. So yeah, I guess there's a lot that, and I'm doing a terrible job in summarizing all of it, but
Oh, no, you're fine. Yeah, and I think definitely the big thing to hone in on is the hindsight's 2020. Like you don't realize how much you get out of something until you're on the other side where it doesn't suck as much, like going through it for sure. And I mean, and definitely just from your perspective as well, like seeing them go through the entire process and then go out that other end, satisfied, reflecting and learning that much from the program, and, them going out into the workforce. Like I'm sure that that's very satisfying for you. But do you have, and like a common thing that I hear that program directors, like their favorite part of the program is seeing those students like progress from start to finish. But do you have a specific thing that is your favorite part about the program? And it can, go in depth regarding that intern process or anything specific.
yeah, I think it's students almost having that light bulb moment, and recognizing that you kind of have to just let things go, because no matter what, how many times I tell students, like, this is reality. There's people who are going to listen to what you say, and then there's a lot of people who are not going to listen. And so if you have those open communications with the medical professionals themselves who are taking care of that patient population, you'll be able to get a more appreciation about that. And I think it's just, it takes time, right? I've been doing this now for many years. But it is very interesting to see how each student like evolves on their own and comes to the realization of, this is a better spot for me, or this is a better spot for me, right? So I think that's the whole thing too, is, and I'm going to tell you, so many students come into the program thinking clinical, that's all I'm going to do. And then some branch out and they're like, well, I think I'm going to get a PhD, or I think food service is calling me, or what about the industry? I didn't even think about that. And so it's very nice to see that they are diversifying their viewpoints and appreciating all that dietetics is, because I think sometimes we come to this realization that dietetics is only these small categories, when in reality, there's so much more to it. And like I tell most students, hey, if there's not a dietitian working there, you be the first to start working in that field. Because sometimes we do have to kind of get ourselves involved a little bit more than we currently are. And I think one way is for students to kind of explore those avenues to say, yeah, a dietitian is needed here. Why isn't one ever been hired? So that's also very interesting to me.
Yeah, definitely. And like, I really like how you mentioned, if you go in with this mentality, being open to diversifying what your previous thought process was, for sure. And I think a lot of people, even if they're not in an internship yet and they're getting ready to apply, kind of having that mentality of, being open to, even if you think you want to go into one thing, of course, pursue it, but then also if something else catches your eye, not being afraid to go for that. And so kind of going into the perspective of prospective students applying to dietetic internships or internships in general, is there anything you wish students were more aware of when it came to applying for supervised practices, specifically in dietetics?
I wouldn't say more aware of. What I would just put caution to is money is involved, right? And I'm not here to promote, obviously I'm here to promote my program, right? But it's going to cost, and it's okay if you really are desiring to go to a place and that's like number one for you, whatever you want to do, and you're like, this is the internship for me, but then you look at the expense of it and you're like, well, I can't afford it, let me just go to the lesser program, right? Whatever that is in your mind, you're going to get a job, you're going to start making money, you're going to pay back those loans or whatever it is. It is unbearable. Believe me, I had to pay for my education. It's a pain. But sometimes you have to look at, so is that your only con? Go for all the pros, right? What can you actually get out of it? The other thing that I hear, and it obviously is going to change now that 2024 is here, but the rush of, let's not get a master's, let's just do an internship. And I do agree that, right, so there are some individuals who maybe getting a master's at this point in time to push them into that is unfair. I understand that. But there's a lot of students that I see are like amazing and would be brilliant to continue on to pursue a master's, to do an internship. And yet they're like, I think I'll just do an internship now because the 2024 rule hasn't gone into effect. And so, it's always like, I don't want to say my children, right? But it is almost like talking to my kids, because it's like, no, I know, I've lived through it. I have many more years of experience than you. Trust me when I say, go for it. You need to do this, as opposed to saying, nah, I'll just go with what my friends are doing. And so it's kind of like trust your own confidence and instincts and listen to those who have been in this position for way longer than you have to know, wait, I should listen to them and I should say, yes, I should apply to this spot no matter what, because once you get in, it's an amazing feeling. And then you forget every kind of hesitation that you had previously.
And I think it's great how you focused on that financial piece. And because I mean, I've definitely taken a personal, note to that as well. That's because of how I was raised. Like, both my parents, they were in a lot of debt. And whenever I was being like raised up in that, they never pushed, the fear of debt onto me. But, when you're raised in an environment where money is a big thing circulating, it's a big thing on your mind. And so I definitely do think with the 2024 changes and just with the thought of paying for more money to go to school or, like doing a more expensive internship, you also do want to think of the value that you're going to get personally out of it, not just the value of the dollar. And so I just think that that is a great thing that you highlighted for sure, and that a lot of people shouldn't like shy away from whenever it comes to choosing internships or choosing programs. And so I'm really glad that you mentioned that. And going back into the application process with dietetic internships and now future education models, graduate programs, all that jazz, like all those different types of applications, personal statements are, across the board required for the application. And so just given that, you are a director and you see all these applications go through, going to the personal statement aspect, do you have any advice to give students about writing a personal statement that you feel like goes underlooked or, to make them stand out more for reviewers?
It's almost like the imposter syndrome. You are great, write about it, right? So I tend, the first paragraphs tends to be cliche-ish at points in time. You're like, yeah, okay. Honestly, I don't even remember what my personal statement was, because that was many, many years ago. But if anything, I would probably say that I was the most honest person in my personal statement, because it was kind of like, I fell into nutrition because I got aggravated, and this is honest to God. I got aggravated with my dad because he would never listen to me. He had type 2 diabetes. He was the epitome of, I'm not going to listen to a word that my doctor tells me or anything. And so I got mad. And so that was my frustrating kind of personal statement, which is, I want to change those who are too stubborn. Not to change the world or anything, but just to kind of get into someone's head about, why don't you want it? Like, what is going on that, and I don't have a minor or anything in psychology, but that's a huge component of it, right? Is kind of like what's going on. So I think if you're open and honest, and that's fine if nutrition struck your core because you took a class, fine. But what else was there? There has to be something deeper than, oh, that was cool, that faculty was interesting, or that made my life, more fascinating, and I got an A in it, and I thought, oh, could be the area that I should pursue. So I think that opening statement has to be there about really digging into why nutrition. I think another component that most students are hesitant to address is, what are your weaknesses and how can our program help you overcome them? No one wants to admit that they are not good in something. But in reality, if you were amazing in everything, why are you even looking to get a master's or doing an internship? Because you should be able to, just become a dietitian without having to go through all this extra jumps, if you will. So I think that's the other thing. Own your weakness and kind of explore how a program can help you. I'm a terrible writer. I'll be very honest about that. And I've learned how to be better over the years. But I think that was the biggest thing that I put into my personal statement for getting into the doctorate program was, I suck at technical writing and I want to learn how to improve it. And the only way I can do it is by going to this graduate program. So I think owning your weakness and not being afraid to confront them, and not to say, I'm not great at public speaking, but I've learned how to do it better. It's like, well, then you overcame that weakness. So what can we do for you? Nothing, because now you're a perfectionist and everything, right? So I think owning that weakness and just exploring it more and being more honest about it instead of looking at it like we're going to judge you. So that's the thing. No one's a perfectionist. Be okay with just saying, I need help in this area, and this is the way your program can help me.
And I think it's great how you're tailoring to and this is how this program specifically can help me, because definitely tailoring it to the specific program that you're interested in, it really does add that more personal touch of, hey, this is imagining me in your specific program as you're the reviewer of that specific program. So it definitely adds that more personal like touch and like showing your involvement into wanting to be in that program, which I think is really great. So you've given us a lot of really good information about your program and like that kind of interpersonal touch of like, you know, your favorite parts about it, intern favorite parts about it, and like a little deep dive into the technical, you know, parts that students probably want to hear about your program. And you've also just given a lot of great advice. But is there any last note or last thing that you want to end on, in whether it be involving your program or just in general regarding students aspiring to become registered dietitians?
Yeah, I would say don't hesitate to talk to other individuals. I know that there's wonderful mentor programs out there to kind of communicate with dietitians and everything. But I think everyone has a story, right? And how did they fall into dietetics? And what are the kind of issues and the positives and negatives, not to dissuade anyone, but just to kind of bring in reality of what a dietitian's life is truly about, and that there's going to be highs and lows. Many of us, right? So academics, most of us started out in the clinical world, clinical community, whatever, and then we ventured into academia, right? So even hearing the stories about how did that happen? Why did that happen? You know, what's going on? Because to be honest, it's rare to see nowadays people staying in one profession their entire life. There are many people who may, but they may shift into different kind of platforms, right? Different universities, different hospitals, still maintaining being a clinical dietitian, but just in different areas that they're pursuing. So just be really, again, open-minded. Let go of the controllingness. It's tremendously hard. I know for sure it's really hard to do that, but sometimes you just have to let go and enjoy life for what it is. And yeah, just kind of explore what is out there before saying, gosh, I'm going to nail myself to this area and that's it. Just be open and willing to say, I don't know what I want to do. And that's the whole reason you do an internship, to kind of figure out where possibly do you want to go. And it may change 2 years down the road when you're in that career. You may decide, nah, I don't want to do this anymore. I'm going to go someplace else. And that's okay. But don't lock yourself into a box where you think this is it and this is the rest of my life. Really be open to exploring what dietetics can actually offer you.
Yeah, and I think that's a great note to end on, and just that there's a vast field of dietetics and really the world is your oyster. So yeah, thank you so much for talking about your program and also just giving great pieces of advice for students aspiring to become registered dietitians. And again, thank you so much for just giving us a lot of awesome words of wisdom.
Yeah, thank you.